Good evening. Welcome to Raaonline. Today we'll see another congenital heart disease which involves the mitral valve and the valve's apparatus along with the mitral valve. Congenital mitral valve diseases. As a isolated entity, this is very rare. So among all the mitral stenosis, congenital mitral stenosis is less than 1%. And total mitral valve diseases among all the congenital heart disease occupies less than 0.6%. So mitral valve diseases can be divided into stenotic, regurgitant or mixed lesions. So in most of the cases, one lesion is predominant over the other. So to see the normal mitral valve anatomy, we have already gone through this in acquired heart diseases, mitral valve diseases. We'll go through it again. So this is a mitral valve apparatus which is attached to the annulus. So the annulus is a fibrous body which is continuous with the central fibrous body of the heart. So the next very important component of mitral valve apparatus are the two leaflets. Next important two components are the two leaflets. So the anterior leaflet and the posterior leaflet. Anterior leaflet is obviously larger than the posterior leaflet. The surface area of the anterior leaflet occupies more than 2/3 of the total surface area of the mitral valve. So both the leaflets have three scallops, A1, A2, A3 of the AML, P1, P2, P3 of the PML. So A1 and P1 are from the lateral side. Two commissures, one is the anterolateral commissure and the other one is the posteromedial commissure. So the anterior leaflet is in close relation with the aortic valve, while the lateral side of the mitral valve leaflet is in close relation with the left atrial appendage. So the mitral valve, normal mitral orifice area is about 4 to 6 square centimeter. The contraction of the annulus during the atrial contraction and the ventricular contraction can change the mitral orifice area about 20 to 40%. So the contractility of the atrium and the ventricle, the integrity of the LV myocardium is important for laminar flow across the mitral valve. So the next component are the cardae, which are the attaching tendinous cords which attach the leaflet to the papillary muscle. So these cardae are divided into primary, secondary and tertiary cardae. So this is the trans-esophageal echo, 3D echo showing the anterior and the posterior mitral leaflet, the three scallops. So the lateral portion of the anterior mitral commissure, the lateral commissure is close relation with left atrial appendage. AML is in relation with the aortic valve. There are three classes of cardae, primary, secondary and tertiary cardae. So this is the mitral leaflet. So they have divided the anterior leaflet separately from the posterior leaflet. The papillary muscles are divided into posteromedial papillary muscle and anterolateral papillary muscle. So here the leaflet up to 1 centimeter from the free edge is called the apposition zone or the coaptation zone, which is a translucent structure. And the rest of the leaflet is called the rough zone. So it is not as translucent, as the name indicates, it's a thicker portion. So the primary cardae are attached to the tips of the leaflet, while the mid portion of the leaflet attachment are called the secondary cardae and tertiary is to the base of the leaflets. And the leaflet attachment of the cords are called the strut cords, while the papillary muscle attachments are called the basal cords.